All right, good afternoon, everybody. This is the December edition of our School Health Update. I want to welcome everybody who joined the call. My name is John Banuelos. I am the School Health Liaison for the Rural and Tribal Communities for our Youth in Schools team. We have an exciting edition today with some great presenters. If anybody else has come in, please, put your name and your address or email address in the chat so we can know where you're from and give you a thank you. I'm going to start off here with the agenda today. So we'll have some announcements for the agenda. They'll go in with our Not Alone program. We'll have the EPI update. We do have the Office of Injury and Violence Prevention, presenting Mark Pearson. REACH program, the presenter will be Christina Flores. And then Responsible Teen Drivers program, presenter will be Sam Cha, actually. And then we'll end it also with a Q&A. Normally, if this is your first time here for our school health update, we usually hold questions until the end of the full presentation, or you can put those in the chat here and we will get you an answer from one of the presenters. Like I said, also, I do have, we're also going to have one of our deputy directors come on, say hello to us. This is our new deputy director, John Netherland. When he's available, I'll have him chime in. But as we're going forward, I'm going to step up to our announcements page here. So I want to let everybody know on the call that our school health update calls will be changing coming on January 2026. We're going to include a mental health aspect to the calls. That's going to give us a more holistic approach to health in general, expanding invitation to counselors and social workers. More to come on that. And again, don't forget that we do have a school health newsletter. You could click on that link there to sign up. All right, just double checking here. Did Deputy Director John Netherland join the call? If you are, please let us know.
Yeah, hey, John.
Hey, how are you doing, John?
I'm good. Sorry, I was trying to transition from another meeting.
Of course. Yeah, please go ahead and introduce yourself, John, and then this is our school health update December edition.
Yeah, so hi, everyone. Good afternoon. My name is John Netherland. I'm the, as of August, the Deputy Director for Pima County Health Department, overseeing health services and surveillance, which includes the Youth in Schools team. So really happy to meet everyone and happy to take part in this call. I come from a background of public health, over 20 years at the CDC, recently moved here from Atlanta, and I've really enjoyed getting to know Pima County and really eager to work not only with the rest of the Pima County Public Health, but specifically the school districts and the adults and parents and everyone else who supports youth in this community. So just wanted to quickly say hi, and yeah, I don't want to interrupt the meeting too much more, John. So I'll hand it back over to you.
Thank you so much, John. And you've been doing great work so far. We really appreciate you here with us at Pima County. And I remember you joined us in summertime. Now here it's wintertime. So hopefully it's a little bit better.
Yeah. I've liked the transition. Yeah, absolutely. Except it's dark a lot.
Yeah. All right, so we're going to go over to our next slide here. And as I mentioned, the changing of the health update is going to include some youth mental health services. Just to kind of give a brief overview of our youth mental health services that we do promote here at the Pima County Health Department. You're not alone. It's a behavioral health services part. And Pima County has teamed up with La Frontera to increase access to mental health care services for youth and young adults ages 24 and under living in Pima County. Services are offered up to 5 free therapy sessions with a master's level therapist. Youth initial intake and wraparound service are as needed. And of course, the eligibility for those services is going to must be 24 years old or younger, must live in Pima County. And if you're 17 years or younger, you must have legal consent from a parent or guardian. On the next slide here, it's going to be the landing page of what the You're Not Alone program has. And you can see there we have the therapy boxes. That's where you would click on that to get the 5 free therapy sessions, suicide prevention. We have also a Be There certificate, which is very fortunate for us to offer here in Pima County. And then, of course, support for school and parents. We'll definitely talk more about that in our next school health update, which will be in January. And again, like I said, we'll have some counselors or we'll have some other program coordinators from other um, uh, programs join us for that call, and we look forward to that. And we can see here there is the website here for this landing page in the chat if anybody wants to click on that and join along. All right, so we're going to get into our health update here. We believe we'll have the Epi Division update, and we have Megan Randall. Megan, are you on the call?
Good morning, or sorry, good afternoon. I am on the call. Hi, this is Megan over with Epi. I'm an epidemiologist, and I'm going to provide you an update. Go ahead, next slide, please, John. All right, so our first update is our respiratory update. That includes COVID-19, RSV, and influenza. Next slide, please. So this is our chart for RSV. Down here below, the solid pink is this year. The dotted pink is last year's, and then the solid black line is our 5-year average. And you can see we're following last year's pattern, still very low, unlike our 5-year average. And we may be seeing a slight decrease right now. We were at an increase, and it seems to be, as of last week, that it's starting to go down in our numbers. Next slide, please. Our next slide is influenza. Again, same statistics, except this is the solid blue, and we are seeing an increase with influenza, specifically influenza A. The state, it's not just in Pima County, but all of the state of Arizona is seeing this increase in influenza A. Great time to do a reminder of washing our hands and respiratory etiquette, and I'll show you some examples later on. Next slide, please. And we have our, yes.
Don't forget vaccinations.
Yes, absolutely. Get your vaccinations with flu as well as COVID. They are recommended, and we can go over those in just a moment. Right now, here is our COVID-19 seasonal update. We are still seeing very low numbers. It is staying consistent, but we are seeing a slight increase. Go ahead and have our next slide, please. And here is a combination of all three together. Down at the bottom, you'll see that web page, Pima County Respiratory Illness Data website. You can actually check these weekly on Wednesdays when they are updated, when we are not having these meetings. Go ahead and have a next slide. All right, so this is reporting and resources updates. Go ahead and have a next slide. So we have a new portal. It looks very similar if you were around during the COVID times when we were reporting individual cases. Now we've added GI. So not only can you update and reporting to us through this website, you can do it through respiratory, so COVID cases, influenza cases, and now GI. So you can report outbreaks through this, and you can report individual cases. You can go ahead and scan the QR. And when you get these slides, I know, John, you send them out as a copy, you'll be able to actually click it and go and see the website yourself. I can demonstrate if you'd like. Go ahead and next slide. All right, a gentle reminder of what's reportable in the state of Arizona. I know this was here last time, but we didn't see that second page. So these are all the reportables for schools and daycare centers and shelters, what's reportable and with the details. When you come in, you can, epidemiology is going to ask you your name and address of your facility, how many individuals are having this disease that you're reporting, date and time when you started seeing signs or they told you they tested positive. We're going to ask you the number of rooms or location of what's going on, how many kiddos in what room, and the name of the room. Little information about that. And then we're going to ask information about the individuals. This helps us confirm what's going on in your facility, helps us get testing taken care of. That includes name, first and last, your date of birth or an age. If this person is a minor, we need their parental information. They're adults that are responsible, so parent or guardian, their information and contact information. That includes address and phone number. And most importantly, we need to know when they were last at your facility. This helps us find out when the last exposure was, and we can start the countdown in the event of an outbreak. So we can try and limit exposures and identify close contacts. We also need to know if this person you're reporting is a staff member, student, a volunteer. How are they associated to your facility? We also need to know general numbers. How many normally are in this classroom or in this gathering, or how many were at this gathering? And of course, if we don't have it already, your contact information, who's going to be our point of contact at your facility, so we can help you with the guidance and carry on and recommendations and sending you information as outbreaks or individual cases progress. Again, you can see larger copies at that link with the ADHS school reporting guidelines. Go ahead and have next slide, please. All right, so previously I talked about this is a great time to have a quick lesson on respiratory etiquette, how to cover your cough. CDC has a great presentation here you can print yourself. It tells them how to cover it, and then the next line of defense is when to wash our hands. They also have slides of how to wash your hands, depending on your kiddos, your audience, how old they are, can they read, can they not, what kind of pictures. They have lots of different ones that you can print out. This is a great one. It says when to wash. They may know how, but they don't remember when. So this is a great visualization of when they can do this. Doing these two things is your number one thing you can do individually, other than getting vaccinated, to prevent these diseases we know are coming around. It's respiratory season, it's flu season, COVID doesn't seem to have a season. It seems to be always, but this will help. Again, recommendations for vaccinations will come along. Next slide, please. Oh, we got this out of order. That's okay. I'll show you in a minute. So this is hand, foot, and mouth. We've been seeing a big increase, not just here in Pima County, but in the state of Arizona. Go ahead and next slide. So help us out, holiday season, there's lots of gatherings. Hand, foot, and mouth is a virus. It's very easily spreadable. It's not just person to person, fecal, oral. It can be even on clothing. So if you changed a dirty diaper and you don't know it's on your clothes, you can spread it to the next kiddo. So hands and feet, or hand, foot, and mouth disease, very, very spreadable. First signs are fever, sore throat. They kind of get, if they're really young, they get lots of drooling. They get a rash kind of on their hands and their mouths and their feet because they're touching everything. And this is a good time to make sure we're up on our cleaning. Definitely washing our hands with soap and water, disinfecting toys. Avoid sharing all the toys. Maybe kiddos can have their own toys. I know we love to share and we're teaching sharing in the classroom, but now's not the time. We're seeing these numbers increase. Maybe have kids have their own set of toys. If you believe you have an outbreak, please give us a call. There's our contact information, our email and phone number, and we'll be here to help you. You look at your cleaning supplies. There is a list where you can look up by the FDA that tests products, and they prove can it clean these products or these against pathogens. And you can look them up and see, yes, this product I am using will kill whatever disease you're looking for, hand, foot, and mouth, COVID, flu, norovirus. Lots of great resources. Next slide, please. These are the resources. All these are clickable links. ADHS has wonderful kits. They even have an app for your phone. I use it. It's a great way. Vaccinations, if you need to know you've got a kiddo who's asking questions, easy. Quick go on the link on the app, click on vaccinations, and it shows the current recommendations. It also has inside here a flip chart of all the diseases, hand, foot, and mouth, influenza, anything that's reportable and even non-reportables are in this chart. Talks about what to look for, what signs and symptoms, how long it's infectious, how is it transmitted. Great resource. ADHS also has a weekly respiratory data. So maybe it's a holiday season, you're going to see family somewhere in Arizona. You can actually go on there, see what are their numbers looking like. Great resource. There's Pima County's respiratory illness data too, as well as CDC vaccinations. If you want more details about influenza, RSV, or COVID, that's your resource there for the respiratory viruses. Vaccinations, we definitely recommend get them, especially if you qualify. If you have further questions, there's our contact information to EPI, as well as our email. And I believe this is our last slide. Excellent. And if you guys want a demo of the portal, please let me know. I can pull it up and we can walk through it if we have time.
Thank you so much, Megan.
Mm-hmm.
That was very, very thorough, and I really appreciate those updates every school health update. So we're going to have our next presenter, Mark Person from the Office of Injury and Violence Prevention. Mark? Hey, Mark, I'm so sorry. I think you're muted. I don't hear audio. I'm sorry.
Mark, I see that you are unmuted, but we're not getting any audio on our end. Hey, Mark,
I heard
if
something.
Mark, if you are still trying to talk, I maybe try hopping off and hopping back on. And while that's going, John, maybe should we just skip to the next presenter while Mark is figuring out the technical issues?
We'll do that.
Hey, John, sorry, I don't know if this is how the format works, but I actually have a question regarding the previous EPI update and how the schools use that information, or if there is a relationship between the schools and the health department regarding apps. The schools, from my previous experiences, look at absenteeism rates both among students and among teachers to sort of gauge what's going on, especially in respiratory season, for their student population and their staff population regarding increases of communicable disease, especially around the respiratory season. And I just didn't know if there was a relationship between the school systems and the health department regarding absenteeism rates and some of that data sharing on a regular basis. Happy to hear either from the health department side or from the school side if they have comment.
Sure. So is Megan, are you still on? Do you want to tackle that question?
Yes, I am still on. John, as far as I know, the schools do not share that information with us unless we ask, and we traditionally just get statistics. We don't get detailed information. They only contact us if there's an increase in any type of reporting of absenteeism. If parents say my kiddo has been tested positive for whatever, they put that in there. But I would love to hear from the schools if they have information on willing to share data with us.
Or how they use the absenteeism data to make decisions about school closure or different other interventions. Over.
And any schools who are on, if you want to also answer that question, you could put that answer in the chat there for us, okay? I think we got Mark. Are you Mark on? Still don't hear the audio. Okay, why don't we do this, Mark? We'll just come back to your program. I'm going to skip to the next one. Is that okay?
I'm ready, John.
Okay. Hang on in there, Mark. We'll come right back to you, and we'll get that audio fixed. So we're just going to skip ahead real fast. Christina Flores is going to be talking from the REACH program.
Good afternoon, folks. My name is Tina, and I'm here with the REACH grant program today, representing the COPE division of Pima County Health Department. COPE, Community Outreach, Prevention, and Education, also has partnered with John and the Youth and Schools team, and we've conducted several activities, and I'm pleased to be here to share with you a little bit more about what REACH is and what we can offer the school health team. Next slide, please. So this slide, I'll just summarize REACH, and of course you can refer back to the slides, is a federal grant in 50 states, 32 states, 50 organizations. And our main priority is to make healthy eating and active living more accessible and affordable to priority populations. And Pima County has identified 13 key zip code areas which we have prioritized for our work with the REACH grant. Next slide, please. So the REACH grant, we have prioritized 4 specific areas, and mine is physical activity. I have come to the REACH grant through my work with the Bike and Pedestrian Safety Program, and also with the School and Stock Inhaler Program, which I'm sure you're familiar with, and also with the Air Quality Flag Program. I had been working in the schools, and with my Bike and Pedestrian Safety Program, I had been working with middle schools, providing bike and pedestrian safety education and actually conducting on bike and on-road bike activities. And so my role gently morphed from close to 30 years as a physical education teacher and a coach to my role here, working with the REACH grant, prioritizing schools with safe and accessible physical activity. Next slide, please. So, as I mentioned, we have priority populations, and this year we are working very closely with Summit View area and community. And currently I've been working with Craycroft Elementary School. And so with our chosen strategies, we're working with physical activity, playground improvements. We just conducted walk and roll to school at the school. And we're also planning to conduct walking audits to take a look at the environment to see what we can do to help encourage, promote, and bring awareness to how important it is to have safe streets and sidewalks so that our children and families and communities can walk to their everyday destinations. Next slide, please. So part of our REACH grant also reaches out to early care and education. We provide technical assistance for nutrition and physical activity. Next slide, please. So we work closely with different organizations in the community. We look at the environment to see if we could encourage, promote, and bring awareness of different methods to encourage physical activity. We provide Go Knapsack, which is a fundamentally sound educational program for nutrition and physical activity. Next slide, please. Here are some of our nutrition strategies. We provide produce prescriptions. We support classes for gardening. We support enrolling in fruit and vegetable incentive programs. Next slide, please. Right now, we are working closely with Sawaditha Food Bank, the Marana Food Bank. Some of the other programs which we collaborate with is HOP, Healthy Arizona Workplace, UA Garden Kitchen. For example, with my bike and pedestrian program, I work with Greater Arizona Bike Association, which supports me and our fleet of bicycles with bike repairs and maintenance. Next slide, please. This strategy is the one which I work most closely with. So we take a look at policies and plans for systems change for community design. So one of the strategies for Craycroft Elementary is to bring more awareness to the school community of what's offered in the local park. The school happens to lie next to the loop. So a lot of people in the community are even unaware of the loop. Next slide, please. So we've conducted a landscape analysis of the area. We're conducting walking audits to see if we can improve transportation and the ability to walk and ride your bike to school in the area. Next slide, please. Here are other activities and future plans. We support media campaigns and amplify. We look at different spaces in the community and become experts so we can promote and educate about the areas. And of course, education and encouragement. A couple of the slides, the photos there of our Ajo Biking Club, which we support with bicycles, maintenance, parts, education, training. And there on the left are gentlemen from GABA repairing bikes at Dietz Elementary. Next slide, please. So here we are promoting walk and roll to school with our proclamation with the Board of Supervisors. On the lower left, we're supporting walk and roll to school at Craycroft Elementary with a principal, Mr. Badia. And at Craycroft Elementary, we're supporting the Healthy Hawks. They've created a pledge to become healthier this school year. And walk and roll to school is easy and accessible, and I can help you connect with people who can bring you a scooter and a packet to conduct activities, whatever would suit your school and your staff. Next slide, please. So I end with a slide on walkability and Walk Score website. And so one of the things that our program is encouraging is taking a look at your community and seeing how you score in terms of walkability and how safe you feel in your walking environment. And so please reach out to me, Program Coordinator, Pima County Health Department. I'm here to support and help school health nurses and staff. Of course, you are all dear and close to my heart as a former physical education teacher, and I appreciate all your work and help, and we are here to help you and your school and your staff and your community to be the best that they can be this year. Thank you for being here. Thank you for your time, and thank you for having me.
Thank you so much, Christina Flores, for that wonderful presentation about REACH program. Mark, are you back on? I want to see if we get your slides up. See if we hear Mark. If I don't hear from you, Mark, I'm going to head on to the next presenter. If that's okay. All right, we're going to go forward for the next presenter. We do have Sam Cha from the Maternal Child Health Program. Sam, are you on?
Yes, I'm here. Can you all hear me okay?
Yes, we can.
Okay, perfect. So, hi, good afternoon, everyone. My name is Sam Cha. I am a health educator with our MCH program, which stands for Maternal Child Health. And the program, we cover several initiatives dealing with infant, child, and youth safety. And one of those is our Responsible Teen Drivers program, where we cover safe and responsible teen driving practices and behaviors. So next slide, please. So I usually, I'm the health educator. I do a lot of outreach, and we work with high schools, family resource centers, community centers, places like that where teens and parents of teens are present. And so this is kind of a shortened version of the presentation I usually do, but we can take a look at some of these statistics here regarding teen driver safety. And 43% of high school students admit to not always wearing a seatbelt. And then also among 16, 19-year-olds who died in car crashes, almost half were not wearing a seatbelt at the time of the crash. So wearing your seatbelt, whether you, any of your passengers are all buckled up, that is one of our important messages we always cover there. And in 2020, about 2,800 teens in the United States were killed, and about 227,000 are injured in motor vehicle crashes. So you can see that's still a pretty high number there that we are actively working to reduce. Next slide, please. So also some additional statistics here, 39% of high school students admitted to texting and driving in the last 30 days. And so that's another one of the points we emphasize is make sure that when you're driving, especially for teen drivers, since they're newer to driving, they don't have as much experience, they should not be on their cell phone at all, whether texting, talking, scrolling social media, watching TikTok videos, anything like that. We just say, hey, don't be on your cell phone, period, while you're driving. And then also, we also emphasize never driving under the influence of drugs or alcohol. So 29% of drivers aged 15 and 20 who were killed in a fatal motor vehicle crash had been drinking. So again, that's another area that we always emphasize to teens, to never drive under the influence of drugs or alcohol. Next slide, please. Okay, so this is a interesting study. It was done by Liberty Mutual, which is a auto insurance company. You may have seen their commercials on TV with Doug and the Limu Emu. But this is an interesting study where they not only surveyed teens about their driving behaviors, they also surveyed the teens about the driving behaviors that the teens have seen their parents engage in. So, as you can see, 94% of teenagers admit to speeding while they're driving, but they also 88% of those teens also say that their parents also speed while they drive. Other, kind of interesting statistics are, 90% of teens have admitted to talking on their cell phone while driving. 78% admit to texting while they're driving. And you can see that, talking on a cell phone while driving, for the parents that teens have, reported, it's actually about the same for parents. And then the texting is a little bit lower. But one of the things I do emphasize when I do present to parents of teens is that you need to be a good role model for your teens as well. So if, say, you're texting and driving, or you're not wearing your seatbelt, your teenager, may interpret as, okay, it's fine because, my mom texts and drive all the time, so it's okay. Or my dad, never wears a seatbelt, so why should I need to wear my seatbelt? So again, emphasizing to parents of teens that, hey, if you model good behavior, your teens are more likely to follow that as well. If you could do that. And so next slide, please. So here in Arizona, we do have a graduated driver licensing law. I go over this a little bit with the teens I present to. Here in Arizona, 15 years and 6 months, 15 and a half is when you can get your learner's permit. And then after that, at age 16, or at least you have to have it for at least 6 months, you can get your graduated driver's license. What that means is there are a couple additional things that, some conditions that you have to do before you get a full privileges for your driver's license. During the first 6 months, with that, with the graduate driver's license, those teenagers are not allowed to be driving between the hours of midnight to 5 a.m. There are a couple exceptions that includes if there is a parent or legal guardian in the passenger seat next to them, then they are allowed to drive during those times. Or if they are driving home from a school-sanctioned activity, a place of employment, from a sanctioned religious activity, or or during a family emergency. The second condition is that teens, they cannot have more than one passenger under the age of 18. This is to reduce distractions, unless those passengers under 18 are one of their siblings, or if they have a parent or legal guardian in the passenger seat beside them. Again, with the parents, to have a teen driver, and then also have some teens in the back seat with a parent. Hopefully the parent could kind of encourage and kind of monitor the teen a little bit better. So next slide, please. So let's talk a little bit about 3 types of distractions while driving, VMC, visual, manual, and cognitive. So visual distractions are if things that take your eyes off the road. So if you're texting and driving, you're not looking at the road, you're looking at your phone. If you're putting on makeup, grooming, things like that, brushing your hair, combing your hair, using like a cordless shaver or something like that, you're most likely looking in the mirror and you're not looking at the road. Manual is anything that takes your hands off the steering wheel. The classic, you need to have both hands on the steering wheel. So if you need to swerve or react, you can do that in a very quick manner. So again, cell phones are a big thing. If you've got a cell phone in your hand, you're texting, you're scrolling through social media, try to find like your playlist for your radio, something like that. That is one. If you've got food, drinks in your hand as well, again, makeup, something like that. Those are all manual distractions. And cognitive distractions are anything that takes your mind off driving and focus off driving. So that could be, again, cell phones are a big thing. So your mind is on your cell phone, who's texting you, who you're calling, you're engaged in a conversation. So things like that would do that as well. So that's one of the things that we talk about. So next one, please. And so here's an interesting statistic here is if you're driving 55 miles per hour and you're sending or reading a text, so the average time to send or read a text is about 5 seconds. That's pretty much driving the length of the football field for eyes closed. So if you're looking at your phone, sending or reading a text for those 5 seconds, driving at 55 miles per hour, that's basically driving the whole length of a football field with your eyes closed. So we always remind the teens, hands on the wheel, eyes on the road. Next slide, please. And so this is just a little bit review of what we just covered with the different types of distractions, visual, manual, and cognitive. I always say cell phones are kind of the perfect trifecta where they cover all three: visual, manual, and cognitive distractions. So that's why, again, we emphasize the teens and parents of teens to make sure that they're not on their cell phones while driving. Even though here in Arizona, the law is you can drive with a hands-free device, but I always tell teens and parents of teens that it's better just not use your cell phone at all. Put your cell phone on do not disturb mode, put it on mute, put it on silent, put it on airplane mode, anything like that. That way you don't hear the pings when your texts come in, or you don't have any hear like the ring when your calls come in. And also we say out of sight, out of mind. Go ahead and put that cell phone away in the purse, backpack, glove compartment, upside down in your cup holder, something like that. Out of sight, out of mind. That way you can just focus on driving. Next slide, please. So at the health department, we do have social media campaigns for responsible teen drivers. We do two main big campaigns every year. We have our National Teen Driver Safety Week, which is usually in October, and then we do our version of, we call it Pima County Teen Driver Safety Week in the spring. It's usually in late April, early May. That's usually about the season when it's prom, graduation season for high school. So it's a perfect time to re-emphasize a lot of these responsible behaviors. Again, we encourage teens. We want you to have fun during those times, but we also hopefully you can do it in a safe and responsible way as well. Next one. And so, okay, the National Teen Driver Safety Week, actually this week, it was actually October 19th through the 25th of this year. And we did have some social media posts that our communications team put on our Pima County Health Department Facebook page. But we kind of have the there's 6 on this one, but we generally emphasize we call it the 5 to drive. So always stay off your cell phones while you're driving, no texting and driving, especially. Always wear a seatbelt, never drive under influence of drugs or alcohol, limit your number of teen passengers to 1 or 0. And then also, buckle, and then also follow a speed limit as well. So those are what we call our 5 to drive. Next one. And then so these are some of the examples. These are, they could be aimed at teens or adults, but they just have some general things that hopefully will catch the attention of parents of teens or teens. Next slide, please. And then this one is more aimed at teens. The campaign, they kind of changed the graphics a little bit. Hopefully it's a little bit appealing to teens. And also they really simplified the rules, like take it slow, everyone buckles up, stay off the phone, no drugs or alcohol, and fewer passengers is better. So that is perfect, short, simple, to the point. Again, probably emphasize more for teens on there. Next one. And then so these are some examples of the ones where they actually break it down into the different things, the different points that I want to emphasize on there. Again, we call it the 5 to drive. Next one. And so this is one of the ideas that, so with different high schools I work with, I always do a presentation so the students can get basic facts, things like that. And then, I usually work with a group from the high school, whether it's student government, National Honor Society, a SWAT class, like student wellness advocacy team, something like that. So I kind of want those students to also take on that mantle of developing like how they want to do outreach or education at their high school as well. So, we have at Miranda High School, this was several years ago, they decided to do safety grams. So they made some different memes, they cut them out and they gave them out during lunchtime. I believe this was Valentine's Day week. So we kind of were saying like, hey, nothing says I care about you more than, hey, I care about you, drive safely, things like that. So next one. And then, again, our two big campaigns for social media we do in the spring and then in the fall as well for Pima County Teen Driver Safety Week, National Teen Driver Safety Week. Next one. And I am going to skip this because I think since I know we have another presenter. So, but this is just a short video. It just kind of encourages parents to have just that conversation with your teenager about being a safe, responsible teen driver. Not just, like, hey, like don't crash the car, but, have a more in-depth, meaningful conversation with, hey, the rules of the road and also establishing consequences as well. So, hey, if I get a call from our neighbor that they see you like speeding around our neighborhood or, driving in an unsafe manner, we're going to take away your car privileges for a month or something like that. Next slide, please. And again, this is just our campaign, Arrive Alive, Don't Text and Drive. Someone had come up with Don't Drive Intoxicated. I know some states, I think Washington was one of the first states where they actually started citing people for, I think they called it driving under the influence of technology. So, while, people who are obviously not paying attention to the road, they can get cited for that. So we emphasize that for teens and actually all drivers as well. So there's my contact information and also our MCH program at pima.gov. If you have any questions, feel free to contact us. And I think that's the last slide on there.
Yes, it is. Thank you so much,
Okay.
Sam. I really appreciate you presenting with us today. Mark, let's see if you
Yeah, can you hear me now, John?
Yes, we can.
Look at that. All right. Sorry, they swapped out my laptop this morning for a new one, and all the settings were all messed up. My apologies to everybody. While he's getting back to the beginning, my name is Mark Person. I'm a public health program manager for the Pima County Health Department. Part of my oversight in that role is to oversee the Office of Injury and Violence Prevention. Just a little bit about that office. We conduct regular surveillance of all different forms of injury and death that occur in Pima County. So that includes things like motor vehicle, bike and pedestrian accidents, drug overdose deaths, firearm related injuries and deaths, homicides and suicides. And the latter of those is the reason we're here today. When we conduct our surveillance, what we're really looking for are any kind of statistically significant trends that change in a sudden way. So if we see a specific age group or an overall total by month or by year, something that goes way above the threshold that we're anticipating, we'll consider sending out a health alert. And what we did last month was a health alert for suicides in youth. And that's what I'm going to cover for you guys today. So with that in mind, we'll go to the next slide. And so what did that health alert look like? So you can see here the data that we look at. So in this instance, we're looking at youth. We define that by ages from 0 to 19. It is important to real quickly distinguish, we did not have youth under the age of 12 that died by suicide in any of these counts. So that would be really rare for us to see. So the majority of these decedents are between the ages of 12 and 19. But you can see what stands out right away is back in 2019, 2020, we had some pretty high numbers when it came to suicides that occurred in Pima County. But every year since then, those had been coming down. But if you look at 2025, and that's a year-to-date count, so it's not an official count yet because we haven't reached the end of the calendar year. But so far, when we did this alert, we had an 83% increase compared to the previous calendar year. So not only did we have an increase compared to the last year, it's also significant because that's the first time we had seen any change in an upward trajectory in over 5 years. So with that in mind, that's why we chose to send out the alert. Next slide. Some of the key findings as well. So we're not just looking at the number of decedents that died by suicide in this age group, we're also looking at what were some of the common factors, what were some of the demographic trends. And you can see some of the things that we identified right away there. So when we look at this over all of the decedents from the last 7 years, you can see 53% of the suicides in these age groups involved the use of a firearm. Below that, 38% involved some form of asphyxia. And then beneath that, you can see 75% of the decedents were male, and 25% of the decedents resided in a rural or semi-rural zip code. All of those are really important to us because it tells us a little bit more about what's going on within this specific age demographic. And that enables us to come up with some key health messaging. How do we prevent this? How do we make the community safer? What kind of resources or guidance can we give to youth and agencies or schools that work with youth? Those are all really important messages. And some of those will be on the next slide. So some of our key takeaways, again, these are all embedded on the alert that we sent out. But these are based on data. These aren't just us kind of throwing darts at a dartboard thinking, hey, let's come up with some safety recommendations. This is all specific to the cases that we reviewed. And it's important to note that we obtain this information not just by looking at data sets. We're actually looking at the police reports, the scene circumstances. What were some of the risk factors involved in these incidents that led up to the death? Number one on that list is limiting access to firearms specifically. What we see commonly, especially with young people, is a young person is experiencing some form of a mental health crisis. They act impulsively, and because of the fact that they had access to a loaded firearm, that scene ended in a tragedy that definitely could have been prevented had they not had access to a firearm. We can't always prevent kids from experiencing bullying. We can't always prevent them from experiencing some form of severe depression or a behavioral health crisis. But if we remove the access to lethal means, that's going to protect that child, at least in that moment. And that's what we're really trying to do. We're trying to make it more difficult for kids to get a hold of things that they can harm themselves with. And it's in our communities, we would like to say, let's lock up our medicine, let's lock up sharps and things like that. But those are very difficult for us. You can't just remove all of those things from a community. Kids are going to be able to get access to medications over the counter, things like that, and sharps. Those are really difficult to limit access to. But firearms are something that we can all do something about. So if you're a parent, a guardian, an adult, and you have kids in your home, the takeaway here is if you have firearms, in your house, please have them locked up securely, either using trigger locks or gun safes, something that prevents access to that weapon. What we don't want to see is people leaving one or two firearms out in a nightstand, something like that, where they're using it for home protection. When it's not in use, please lock it up. Because that's what's happening. We're seeing a lot of these instances where the kids are getting a hold of mom, dad, uncles, grandparents, firearms in the home. And that's something we can all do. It doesn't cost us anything. We're not talking about laws, regulations, things like that. We're just talking about responsible gun ownership. Some of the risk factors that we look at and protective factors in those last couple of bubbles are also important. So when we look at risk factors, and this goes beyond just kids, we're looking at anyone really. This could be adults, young adults, or older adults. But having had a prior suicide attempt is a risk factor for potential self-harm in the future. Social stressors is a big one. We see that a lot when we look at these scenes. So that includes things like a recent breakup or a fight with a friend or a family member, some kind of breakdown in their social network. School stressors is another one. So sometimes that has to do with overlapping, some of the midterms, the big tests, or maybe somebody was expelled or got in trouble at school, or mom and dad weren't happy with their grades and they administered some kind of punishment in the home. Some of those school stressors are also things that we see leading up to some of these events. The use of drugs and alcohol is also another one. And then also recent loss of a friend or family member. That could be some kind of tragedy. It could be a car accident, a suicide, in some cases, unfortunately, homicides. When we see those tragedies unfold, sometimes that places kids at risk for experiencing a crisis like this themselves. And then lastly, protective factors, which I think are probably the most important thing we can all focus on. How do we make kids safer? How can kids make themselves safer? So we know that when kids are connected socially, that's a major strength. So whether that's joining an after schools group or just having a healthy friendship group, participating in sports or hobbies, things like that, any kind of social connection is going to be important. Having a sense of purpose is another one. So kids that are focused on a particular sport or a hobby or maybe an academic pursuit that they're engaging in, some kind of purpose and something that they're looking forward to on a daily basis. Having that appetite to do something and progress on a daily basis is really important. Also, engaging in counseling and treatment is another big one. So we know when kids do open up to counselors, whether that's a therapist or a psychiatrist, or even sometimes just a trusted member of their family or social network, that open dialogue is really important. Kids need a place to open up to and someone to talk to, especially when they're in crisis. Physical activity is another big one. Doesn't have to be like a member of a football team or a soccer team, just, whether that is a child that goes to the park or rides a bike or walks, getting outdoors, engaging in some form of physical activity is really important for not just the body, but the mind as well. And lastly, open communication. That's the last point, especially for teachers, guardians, and parents. Having a trusted, open line of communication with the kiddos is really important. That's how we can tell when something's going on. And when we have those regular check-ins with kids and have that open and trusting dialogue, sometimes we're able to get ahead of some of these things. So that was the last thing I had to present on. I really appreciate the time and apologies again for the technical difficulties earlier. Thanks a lot.
Thank you so much, Mark. We're so glad we got you back on with important information. Hope everybody did learn a lot from that. Again, that's going to end our school health update for December, everybody. I wanted to open up to anybody who has any questions. You can please put that in the chat for us. And also, if you did not hear me in the very beginning, if you have joined the call and this is your first time, please, or actually just put your name and your email address on there. That'd be very helpful for us as well. Again, I want to thank all three of our presenters today. And also, this is our contact information for everybody to understand. You can contact us here at, you can visit us at the www.pima.gov/healthy schools. This is our call. This is our phone number, 520-724-7018. And our email is right here, schoolsupport@pima.gov. All right, I don't see any questions coming up in the chat. I am going to thank everybody for joining us today. Hope everybody has a wonderful Wednesday. And coming up here, I know it's a little early for this, but Happy New Year. Okay, Merry Christmas first, and then everything else. But again, thank everybody for joining us. I really appreciate your time, and we'll look forward to seeing you in the new year for our new school health update. Have a great day. We're gonna end the recording.